So first off, this whole Ozempic thing, I don't know what's going on. You know, I've talked about this at length. I actually just even released a 4-part free video training series, which I'm going to make available to you guys today because I'm getting so many questions about it. It came and it went, and then everybody went nuts and said, we have to have access. We want to see it. We want to see it again. We want to show it to our doctors. So I'm going to make that available in the show notes to you guys. So be sure to check that out and share your name and email with me there, and I will send it right out to you. I talk about this in part 2, but I'm going to talk about it a little deeper today. And first, I want to share a story with you. I get messages, a lot of messages, all the time on my DMs and my emails from people saying, I've been following you for whatever period of time, and I'm doing all the things. I'm doing all the things you teach about and talk about, and I've lost 25 pounds, or I've lost 65 pounds. And some people have lost 100 pounds just doing the simple strategies that I talk about on here for free. And they're so excited, and I want to be so excited for them. But then the next sentence is, now I'm going to start strength training. And it crushes my soul, you guys. It literally, my heart drops into my stomach when I hear that. And this is why. When you lose weight on any low calorie diet or caloric restricted diet, and you lose what you think is fat, you are losing potentially 20 to 40% of your muscle, somewhere on average about 25 to 30, somewhere in there. That's the average lean muscle mass loss when you are losing weight and you're not actively protecting your muscle through prioritizing your protein macros and strength training. That's despite what route you're taking. You could be doing low calorie, you could be doing caloric restriction. Well, that's the same thing, but you could be changing up your macros. Now, if you're eating a protein heavy, there is one caveat. If you're eating a protein heavy diet, you are definitely protecting your muscle more, even if you're going low calorie. But most people are not. Most people are just eating less of the foods they were already eating. A lot of folks, when they find out they have prediabetes or diabetes, they message me. They're often angry and they say, I'm doing everything right, quote unquote, everything right. I just got diagnosed with prediabetes. I'm thin. You guys, this is not exclusive to heavyset folks or people with extra adiposity to lose. This is across the board. It doesn't matter what size you are. If you're not rocking healthy muscle mass, skeletal muscle mass, and the only way to do that is through strength training. It's not just by luck and sitting around and hoping it happens, or good genes even. If you're not rocking good skeletal muscle mass, you will end up, in my clinical opinion, you will end up pre-diabetic or diabetic. It's just a matter of time. It's just a matter of age. I've talked about this at length all over the podcast. So we're going to try to put it all into one episode today for you so that this can be the one I point to, because I get this all the time and people say, I'm doing everything right, Dr. Tyna. And I'm just so upset because my doctor said I'm pre-diabetic. What is going wrong? I eat a ton of meat. I do everything you say. And then I ask, are you strength training? And they always say no. They always say no. And I'm just like, oh, I want to beat my head into the wall at this point. I don't know how to get it through people's brains that you have to be strength training. This is non-negotiable. I'm not sure if the word non-negotiable is not translating, but this is literally non-negotiable. So do not write me and tell me you're doing everything right when you're not strength training, because that is 9/10 of the equation. I'll tell you what, my patients who came to see me in clinic, I did regenerative injection therapies, which means I was using natural solutions, and more often than not, their own bodily fluids, like their own blood, their own fat for stem cells. I was using their own tissues to process out what I needed and re-inject it, concentrate it down, re-inject it into them. And do you know the one category of patient who always got better? No matter what, they always had great improvement. I could always look them straight in the eye with truth and say, you're going to get phenomenal results from this. It was the people who had good muscle mass. Now, they could have been young dudes eating, junk food and drinking Mountain Dew. Seriously, they could have had the worst diets in the world, and they would still do awesome because they were strength training and they had awesome muscle mass. Muscle mass will take you extremely far in this world. And if you don't have it, you are basically sitting with one foot in the grave, because any good viral infection, any chronic illness, the big C word, both the big C words, can come on through, and you are in trouble if you don't have adequate muscle mass. This is non-negotiable. Those folks always did great, no matter what. No matter if their hormones were off, no matter if their diet was shoddy, even if they drank too much alcohol, it didn't matter. If they were strength training several times a week, they always got great results, which means they were in a regenerative mode. That's what that is telling me. And when I started seeing that patient after patient after patient, I was like, I better start strength training. And then I started studying up on muscles and myokines and what myokines do. Myokines are these molecules that are secreted from your muscle, and they travel all over the body and do phenomenal things. If you think about cytokines, remember the dreaded cytokine storm? Cytokines and myokines are actually the same molecule. It just depends on where they come from. If they're coming out of your fat, they are inflammatory and they are cytokines. If they're coming out of your muscle, they are anti-inflammatory and they are myokines, and they are doing phenomenal things all throughout your body. And we know more and more about this each year. The list gets longer of what myokines do. If you're not actively strength training, you're not secreting myokines, and you literally could be building an anti-inflammatory factory on your body in real time to ameliorate so many illnesses and chronic illnesses and symptoms and issues and aches and pains, but y'all don't want to do it. Y'all just want to sit back and tell me it's too hard, or you don't know where to start, or you're going to lose the weight first and then you're going to start the strength training. If you're losing the weight first, you are losing your muscle mass, and your muscle mass is your metabolic sink. It's your mop. It pulls up all the glucose. And I'm going to tell you how in a second, and you're going to understand this better, why this is completely non-negotiable. Aside from the myokines that you definitely clearly need, all of us do. So if your muscle mass is your metabolic engine or your metabolic sink or your mop to mop up all that extra blood glucose and blood sugars floating around, and you start losing weight, and we know that you're going to lose 20 to 30%, let's say, of your lean muscle mass in the process of losing weight overall. There's no way out of that unless you are actively protecting your muscle like it's your job. So what happens is you've just lost some of your muscle mass. Sure, you lost, let's say you've lost 40 pounds. Woohoo! That's awesome. You're smaller. Your waist is smaller, your butt's smaller, you fit in a smaller size jeans, you're really excited, but you weren't actively strength training during that process. You just lost 20 to 30% of your metabolic engine. So now, not only is your brain reprogrammed, in weight loss, your brain literally reprograms itself to make it harder to maintain that weight loss.